Okay, get ready to rethink your dental routine because today we're going deep, deep into something you might not expect. The connection between your oral health and, get this, your overall well-being. We're taking a deep dive into excerpts from the surprising link between oral health and your overall well-being.
Okay.
And honestly, you guys, you are about to see your toothbrush in a whole new light.
It's funny because I think a lot of times we kind of think of our mouths as like separate,
Right.
from the rest of our body.
Yeah.
But the truth is,
Totally.
it's a gateway to your overall health.
A gateway, huh? I like that. So it's like, obviously, everything we eat and drink passes through there. But what else is going on in there?
Well, for one thing, you've got this incredible ecosystem of bacteria living in your mouth. Hundreds of different species, in fact.
Wow, hundreds.
Yeah.
So it really is like a whole world living in there. What happens when things get out of balance?
Well, think of it like a garden. Right. You need the right balance of good bacteria to keep the bad bacteria, or weeds, in check.
Okay,
When you don't take care of your oral hygiene, it's like letting the weeds take over.
makes sense.
You get plaque buildup, cavities, bad breath, and this is where it gets really interesting. Those harmful bacteria can actually enter your bloodstream through your gums.
Hold on, back up a sec. Bacteria from my mouth can get into my blood. How
Yeah.
does that even happen?
It's pretty wild, right? So when you have gum disease, your gums become inflamed, and this creates tiny little openings.
Yeah.
And those tiny little openings basically act like doorways for bacteria to sneak into your bloodstream.
Okay, that is not a pleasant thought. So then what happens? These little bacterial invaders are just running around in my blood?
Essentially, yes.
Oh, great.
And once they're in your bloodstream, they can travel throughout your body and trigger inflammation in other areas.
Yeah.
This is what links oral health to a whole host of seemingly unrelated health problems. One of the most significant connections researchers have discovered is between oral health and heart disease.
Wait a minute. Heart disease. I mean, I get the whole bad breath thing. But heart disease, explain this one to me.
I know, it might seem strange at first,
Yeah.
but the connection is through inflammation.
Okay.
Remember how those bacteria from infected gums can enter your bloodstream?
Right?
Well, when they do, they can trigger inflammation in your blood vessels. And that inflammation can lead to the buildup of plaque in your arteries, which increases your risk of heart attack and stroke.
So it's not that my teeth are directly affecting my heart, but rather the inflammation caused by poor oral hygiene that sets off this chain reaction in my body.
Exactly. It's all connected. And the statistics are, I got to tell you, pretty alarming.
Really?
Studies have shown that people with gum disease are 2 to 3 times more likely to have a heart attack or stroke compared to those with healthy gums.
Wow. I never realized the connection was that strong. That's a serious wake-up call to take better care of my gums. So heart disease is one thing.
Yeah.
But are there other conditions linked to oral health?
Absolutely.
Oh, no.
Another major one is diabetes,
Oh, okay.
and it's actually a two-way street.
A two-way street. What do you mean by two-way street?
Well, people with diabetes are more prone to developing gum disease because diabetes weakens the body's ability to fight infection.
Right.
So diabetes makes you more susceptible to gum disease.
Okay.
But here's the thing.
Uh-oh.
Severe gum disease can actually make it harder to manage blood sugar levels, which can worsen diabetes.
So it's a vicious cycle. Diabetes makes gum disease worse, and gum disease makes diabetes worse. That's scary.
It really highlights the interconnectedness of our bodies, doesn't it?
Yeah, it does.
And this is just the tip of the iceberg. We're learning more and more about how oral health can impact our overall health.
Okay.
For example, did you know that poor oral health has also been linked to respiratory infections?
Really? I'm all ears. Tell me more about that.
Well, think about it. When you have a lot of bacteria in your mouth, it's easy to, inhale them into your lungs. This can lead to infections like pneumonia, especially in people who are already vulnerable.
That makes sense. You're basically breathing those bad bacteria right into your lungs.
Exactly. And we're finding connections to even more surprising areas like pregnancy complications and even cognitive decline.
Wow. Okay. You've officially convinced me that brushing and flossing are about way more than just a pretty smile. It sounds like we need to take a more holistic approach to dental care. What does that even mean?
It means we need to look beyond just brushing and flossing and think about our overall lifestyle choices.
So it's not just about what happens in my mouth, but also what I'm putting into my body and how I'm living my life.
Exactly. There are 3 key areas to focus on for a truly holistic approach: nutrition, lifestyle, and professional care.
Okay.
Okay, so we've got nutrition, lifestyle, and professional care. Let's break those down one by one. What kind of things should we be thinking about in terms of nutrition?
Well, the first thing that comes to mind is sugar. We all know it's not great for our teeth, right?
Right.
That it's important to understand why. Sugar feeds the harmful bacteria in your mouth, which leads to, plaque buildup and tooth decay.
Mm-hmm.
So cutting back on sugary drinks and processed foods is a great place to start.
That makes sense. But what about the things that we should be eating more of? Are there any foods that are particularly good for our oral health?
Absolutely. Foods rich in calcium and vitamin D are crucial for strong teeth and bones.
Okay.
Think dairy products, leafy green vegetables, almonds, even fortified foods.
So I can ditch the sugary cereal and have yogurt and almonds for breakfast instead.
Got it. What about all those crunchy fruits and veggies we hear so much about? Are they really that good for our teeth?
Oh, they are. They're fantastic.
Okay.
Crunchy fruits and vegetables like apples, carrots, and celery act like nature's toothbrush, helping to scrub away plaque and stimulate saliva production.
Interesting.
And saliva is your mouth's natural defense system.
Oh, interesting. I've never thought of it that way. So those crunchy snacks are actually helping to clean my teeth and boost my mouth's own cleaning crew. Pretty cool. So how does saliva help protect our teeth exactly?
Saliva is amazing.
Yeah.
It helps to neutralize acids, wash away food particles, and even contains antibacterial properties.
Yo.
So staying hydrated is essential for keeping those saliva levels up.
Got it. Water is good for our bodies in so many ways, so it makes sense that it's good for our mouths too. Okay, so we've covered the food aspect. What about lifestyle choices? How do those factor into oral health?
Well, some of the big ones are pretty obvious. Smoking and excessive alcohol use.
Right, smoking is bad for us in general, but I imagine it's especially bad for our mouths.
Exactly. Smoking stains your teeth, increases your risk of gum disease, and can even lead to oral cancer.
Right.
And excessive alcohol consumption dehydrates your mouth, making it more vulnerable to infection.
So those are the no-brainers. But are there any surprising lifestyle factors that can impact our oral health?
You might be surprised to learn that stress can actually weaken your immune system, making you more susceptible to gum infections.
Wow, really? I never considered that. So taking care of our mental health with things like meditation or yoga can also benefit our oral health.
Absolutely.
Yeah.
And getting enough sleep is crucial too. When you're sleep deprived, your body has a harder time fighting off any kind of infection, including those in your mouth.
So basically, taking care of our overall health is also taking care of our oral health. It's all connected.
That's a great way to put it.
Yeah.
And then, of course, there's the professional care aspect.
Right. We can't forget about our dentists. What role does professional care play in this whole holistic approach?
Regular dental checkups and cleanings are absolutely essential. Even if you think your teeth are perfectly healthy,
Okay.
a dentist can spot early signs of trouble like cavities or gum disease before they become serious problems.
That makes sense. Early intervention is always key. But what about those of us who get a little nervous about going to the dentist?
Oh, I understand that fear. But communication is key.
Yeah.
If you have any anxiety about dental visits, be upfront with your dentist about it. They can help make the experience more comfortable for you. And remember, your dentist is your partner in your oral health journey. They're there to help you achieve and maintain a healthy smile.
And don't be afraid to ask questions.
Exactly. The more you understand about your oral health, the more empowered you'll feel to take care of it.
So we've covered nutrition, lifestyle, and professional care. It seems like there's a lot to think about when it comes to taking a holistic approach to oral health. Where do we even begin?
Well, the good news is that prevention is key. And it's really not as complicated as it might seem.
Okay, that's good to hear. So what are the essential everyday things we can do to keep our mouths healthy and prevent problems down the line?
Well, the basics are still the most important. Brushing your teeth at least twice a day with fluoride toothpaste is non-negotiable.
Okay, that one I've got down. What else?
Flossing is equally important. I know it's something a lot of people skip, but it's absolutely crucial for removing plaque and bacteria from between your teeth where your toothbrush can't reach.
I'll admit I'm guilty of not flossing as often as I should.
Yeah.
But you're making me rethink my flossing habits. What about mouthwash? Is that helpful?
Using an antiseptic mouthwash can definitely help kill bacteria and freshen breath.
Okay.
And don't forget to replace your toothbrush every 3 to 4 months, or sooner if the bristles become frayed.
Right.
You want to make sure you're using a toothbrush that's effectively cleaning your teeth.
Good reminder. I think mine could definitely use a replacement. Anything else we should be mindful of?
Yes. Pay attention to any changes in your mouth like bleeding gums, persistent bad breath, or sores that don't heal. These could be signs of a problem that needs professional attention.
So we shouldn't ignore any unusual symptoms. If something feels off, get it checked out. It sounds like we've covered a lot of ground today. But before we wrap up, I want to make sure our listener really understands the key takeaway here. We started this deep dive talking about the surprising link between oral health and overall well-being. And I think it's safe to say we've uncovered some pretty surprising connections. What's the biggest takeaway you want our listener to walk away with today?
Well, I think the most important thing to remember is that taking care of your mouth isn't just about, having a bright white smile. It's about protecting your overall health. The health of your mouth is intricately linked to the health of your entire body.
So we really need to shift our thinking from seeing oral health as separate from our overall health to seeing it as an integral part of our well-being.
Exactly. And the great thing is, taking control of your oral health is totally within your power.
Right.
By making simple, everyday choices, like brushing and flossing regularly, eating a healthy diet, and managing stress, you can significantly reduce your risk of developing not only oral health problems, but also some serious systemic diseases.
So it's about making those small changes consistently and thinking about the long-term impact on our health. What's one small change our listener could make today to improve their oral hygiene routine?
If you're not already flossing daily, that's a great place to start.
Okay.
It only takes a couple minutes, and it can make a world of difference.
Yeah.
Or maybe swap out that sugary soda for a glass of water. Every little bit counts.
Those are great, actionable tips. And I think it's important to remember that we don't have to make all these changes overnight, right? Start with one small step and build from there.
Absolutely. And remember, your dentist is a valuable resource. Don't hesitate to reach out to them with any questions or concerns you might have.
Well said. We've covered a lot of ground today, from the bustling bacterial ecosystems in our mouths to the surprising link between gum disease and heart health. It's been a fascinating deep dive, and I hope our listener is feeling empowered to take charge of their oral health and overall well-being.
Me too. Remember, a healthy smile is a reflection of a healthy body.
And on that note,
Yeah.
we'll leave you to ponder your pearly whites. Until next time, keep those smiles bright and those bodies healthy.